Welcome to On the Table with Ashley. If you've been listening, you know we just finished our last episode of the wellness series, which carried us through fall and into winter. And before we transition into our next series, as we normally do between series, we are re-releasing an old episode as a palate cleanser. Today, we're re-releasing Dr. Alexander Gamble's episode, which was originally released in August of 2024. We think this is a great episode to transition us out of wellness and into our next series, and we hope you enjoy. Dr. Alexander Gamble is a palliative care doctor and clinical assistant professor at Stanford University. He is board certified in psychiatry, internal medicine, and hospice, as well as palliative medicine. After graduating from St. Louis University of Medicine in 2010, Dr. Gamble completed his residency at the University of Iowa Hospitals and Clinics in 2015 and his fellowship at the University of Kansas in 2016. Dr. Gamble spends the majority of his time in clinical practice and is also focused on education, both for residents, fellows, and patients and families. You can find Dr. Gamble on X at Your Friend Alex and on LinkedIn at Alexander Gamble.
Welcome, Dr. Gamble.
Thank you so much, Ashley. It's really a pleasure to be here and to be part of this conversation with you today. Really appreciate you hosting and having me.
I'm so excited for this conversation. I know that may sound strange to people, but I feel like this is an incredibly important topic. And I've had a number of conversations with fascinating people in this space. So I always like to start just hearing a little bit about where you grew up and what kind of kid you were and what you liked to do when you were young.
Yeah, I grew up in Kansas City, Missouri, and lived in a couple parts of town over the course of my childhood and upbringing. And I think when I think about myself as a little person, I think I was really curious. I was really always interested in people. My mom worked in an airline related industry when we were growing up. And so we were often flying, usually to visit family, and often we're flying on passes, which meant I was frequently, even as a small child, seated next to strange adults and picked up the habit of engaging them in conversation. And I think that's why now and throughout my life, I've been able to talk to anybody and have been really curious about people because people are fascinating. So yeah, growing up, I think I was just really pro-social, really interested in people and different experiences. I wasn't a super athletic kid, but tried some different things, played soccer. I ran cross country one year in high school. I was in theater in high school and played music. So I had just a lot of different interests. I don't think I could really focus in on one thing, but when I think about the things that tied those interests together, it was just exploring things and being around different people.
That's so cool. And what do you think led you to the field of medicine and then to palliative care? Were there doctors in your family? Was it something you thought of as a younger person or came to as you grew up? And then also, how did you move from internal medicine to palliative care and psychiatry? Or was it kind of always the plan to end up in palliative care?
Yeah, no, I came to palliative care pretty late in my training journey. I think I got into medicine the way I imagine a lot of people do, with just a very vague notion of, this would be a good career path to be helpful to people. Although I often think about a philosophy professor I had freshman year of college who said, if you want to help people, take out their garbage. That's like a really meaningful and important part of daily life. There's lots of ways to be of service and to be helpful to people. But I think, if you're coming up and express that interest and you show an aptitude in math and science, I think teachers are often really excited to sort of help push you along in that direction. But I had really very little exposure to medicine. I didn't really know what it was, even as I was pursuing it. We didn't have medical people in my family. My dad did go to nursing school when I was in middle school, but I'd been kind of saying, oh yeah, I'm going to be a doctor one day, even before then. So it's kind of a strange thing. But I feel very fortunate that it's actually been a really good fit, that I'm able to say that I found something that I like and enjoy and I'm good at and brings me a lot of fulfillment and satisfaction and meaning. My path into palliative was routed through a kind of unique training in both internal medicine and psychiatry. It's a little bit of a rare combination. There's only, I think, usually fewer than a dozen programs offering that combined training. I got into med psych out of the observation that patients dealing with mental illnesses or serious mental illnesses, especially, they don't neatly organize where they are in the hospital, meaning they get other kinds of illnesses too. It's not just schizophrenia or bipolar disorder or severe depression these folks are dealing with. It's often also heart disease or kidney disease. And I just saw there were real gaps in the care delivery in our healthcare system for those folks, especially. And I was wondering, how could I be part of delivering something better for them? And that's how I got into med psych, which was an incredible training background to have. And I think opens up so many venues for us. But the question that you're often confronted with in that training is, what are you going to do with that when you get out? Because even if you have this kind of joint skill set, most medical systems can't really take advantage of people with that training. And what I found was palliative care was a beautiful hinge point in between kind of general internal medicine and general psychiatry, because you've got people dealing with serious illnesses who often have a lot of symptoms to attend to. And so the internal medicine background helped me with a lot of those physical symptoms. The psychiatry background helped me with a lot more of the emotional and existential and interpersonal aspects of that care, as well as being able to interpret the medical record and help people understand what's going on with them. And so, the focus in palliative care about looking at the whole person. I mean, it's an interdisciplinary practice, which is very kind of a med psych perspective, where it's not just about the physician-patient relationship. It's about a whole team, including social workers, including spiritual care providers, including nurses and nurse practitioners, to really come together, look at the whole needs of each individual and the web of people they're inside of. And so as an opportunity to use that whole training background to really make a meaningful impact for people who are really struggling and often suffering, just for me was such a great opportunity. And so that's how I got to palliative, the winding road that took me to the place I am now.
I'm just struck as you say that I think that every area of medicine could benefit from that sort of interdisciplinary approach. And I know some do, and they're trying, but I feel like that could be, especially for chronic diseases, like that could be better done. So it's sort of interesting. Like, it's wonderful that exists in palliative care, but I feel like it could even broaden.
Yeah, I think you're absolutely right. And I think there's a lot of really thoughtful, brilliant people with that same recognition throughout the healthcare system that are trying to figure that out. I think especially for people with chronic illnesses, like you mentioned, especially people with serious mental illnesses, recognizing that, again, it impacts their lives in many ways. There are many different challenges they're confronted with, right? We talk about the psychosocial aspects of care, right? The social determinants of health. And again, it takes a village. It takes a lot of different kinds of expertise to really meet people where they are and kind of support them on their journey, whatever they're dealing with.
Yeah.
So yeah, I think it's a big challenge for our health systems and something I think a lot of people are trying to take on.
Well, that's good. I'm glad to hear that. So you shared a paper with me, a 2017 paper titled, "And Yet It Was a Blessing, The Case for Existential Maturity," published in the Journal of Palliative Medicine. And we'll put a link to this in the show notes if we can. I don't know if it's public. Hopefully we can do that. And it shares the beautiful and heartbreaking story of Alan, diagnosed with terminal cancer at age 36, and his wife of 2 years, Sarah, and how together they face his illness and death, with ultimately what the authors, I think, coin this phrase of existential maturity. And I think, to me at least, as a layperson, the point is how their story can be a foundation and a model for others. And one of the things that the paper suggests is that it can be, anyone can find existential maturity. You don't have to be terminally ill. You could be healthy and embrace it, adopt it, learn to practice it. And after losing my father to cancer 10 years ago and subsequent deaths of other loved ones, I feel that from some age of maturity, we should all work to prepare for death, and not in like a morose or an anxious way, but just in an existentially mature way, like kind of coming to grips with and planning for. And this is a quote from the paper. The authors note, "This way of being seems particularly capable of love and finds or creates meaningful value, tenderness, and acceptance, even along with other emotions that may be passionate, turbulent, and pained." So I'd love to talk a little bit about your feelings of what existential maturity means and how we can work our way towards it, and whether we need somebody like you, like a professional, to help us, or whether there are things we can do ourselves.
Yeah, that paper, when I saw it presented by the brilliant folks that put it together, the thing that really captured my imagination was, the jumping off point for their work was the observation, right? So this wasn't something that they necessarily developed and said, okay, we need to deploy this in the field. They were observing that we often in our work encounter people dealing with life-threatening illnesses who say wild things like cancer was the greatest thing that ever happened to me,
Hmm.
right? Not because the cancer gave them a great experience in their body, but because of what the experience of being confronted with this serious illness and working that through opened up for them in their life. And I think, anybody who's had a lot of exposure to people dealing with serious or life-threatening situations will observe this, but not always, right? So the observation was, we see this happening, not in everybody. What is it? What is it about? And so they coined this term existential maturity to describe this thing they're observing. And that paper, they were looking through the lens of psychodynamic psychotherapy to kind of think about what are the underlying constructs that sort of make up this notion of existential maturity. The thing that caught in my imagination was, in our work in palliative care, as we are accompanying people on their journey in their experience of serious illness, navigating the healthcare system, but also just day-to-day living with it, dealing with the symptoms and the side effects of treatment, but also the emotional weight of what's happening as that kind of unfurls. What is the opportunity for us to help assess where people are in their individual development of existential maturity with an eye to, as we are more or less existentially mature, how that frees us up to go through this part of our life cycle in a way that engenders growth rather than dissolution. How can we help people build a skillfulness that's going to help them get through this time in a way that helps them grow, where they could say something like, this is, maybe not something I would wish for, but something that's been really in some ways wonderful for me, or opened up new things and new understandings. And so I think it's something that lives in my mind when I think about my practice and the work that I'm engaged in, is to what degree am I able to kind of assess where people are in themselves with their skills in that process, and how can I help them continue to develop that so that they're able to move through their unique individual journey in whatever direction they're trying to go, in a way that's freer, that's lighter, that allows them to face the hard situations with buoyancy, with
Mm-hmm.
lightness, in a way that allows them to express themselves more fully and to learn and to grow even through, what can be a really difficult journey.
So, do you have, I mean, a survey is probably not the right word, but like, is there a process you go through with patients, like where you're asking them questions and they write things down? And I guess I am thinking, like, in some sense, it could become a broader, some sort of instrument that people could walk themselves through, even when they're not, again, immediately facing a terminal illness, just to like, how are you thinking about death and approaching death and preparation for death, that they could kind of, go through, and then it could either there's like courses or podcasts or things that they could do afterwards to sort of become existentially mature if they're not, out of the gate.
Yeah, it's a great question. The authors of the paper, in putting it forward, it's really an academic focus, right? And so their kind of conclusion was, we think this is a really interesting area that warrants more attention and exploration. And so, to my knowledge, there have not been translations, I think, of that work into the kind of tool you described, though I think it's a really interesting question. I think something for us to consider. I think in our work, the way that assessment shows up is, again, keeping the broad nature of each person in mind as we're encountering them, that's kind of the exploration that we make. So in palliative care, ideally we have the whole team's involvement, our spiritual care providers, our social workers, our physicians, our nursing staff, where we're all kind of looking inside of those domains to try to get a sense of, who is this person? And how are they doing as they're embarking or continuing or finishing this journey with their serious illness, right?
Mm-hmm.
Where are there signs of distress, and can we help address that with them? How are they coping? Do they need help developing new or better coping skills? who is their support system? Has it been properly activated? And so I think we kind of in practice try to over time take that broad look. It's of course complicated by the fact that we encounter each person in their circumstances. Sometimes that can be in the midst of like a symptom crisis. And it's really
Yeah.
hard to talk to people about, how are they dealing with existential questions if they're in the midst of a pain crisis? So
Right.
our work is very dynamic and tries to be flexible to meet people where they are, and also recognize that, for folks that haven't spent any time thinking about these questions, haven't had experiences that have put them inside of that domain, it can be really frightening. It can be overwhelming. And sometimes that means their preference might be to not talk about some of these things. They may be a world away from digging into some of the stuff we've been talking about. And we need to respect that. We need to meet people where they are. And it's okay for people to have a preference that I don't want to get into the nitty gritty of those conversations, and that we can understand, okay, so how should we be communicating with you and how can we help you with this? And over time, potentially build a relationship of trust. We're starting to explore even why some of those questions might be worth thinking about could be
Yeah.
a possibility. And I think that's part of the challenge, right? Is that some folks are at such a place of unreadiness that even asking the question can feel confronting. And I think that's important to keep on our radar and to respect. And that's part of that process of meeting folks where they are, I think, is even just saying like, how do you like to be communicated with? How
Yeah.
much do you want to know? And
Yeah.
really engage people from there, and then kind of see where we can go.
Yeah. So that all makes sense. And it's also, I think, one of the reasons that I really wanted to have this conversation in this series is that, and I don't know if there's any like percentage of the population in the United States, but it feels like most of us are not preparing ourselves for this conversation, so that like if you did bring it up, it could be jarring. And so this whole idea of like, I call it kind of like the availability to consider death and dying. And the reason I think it would be great to start that process much earlier when people are not actively thinking about dying is that hopefully they can have done some work before they get to that place and be more open, and then find more peace, in the sort of the end phase. Do you have any thoughts on how we can best bring individuals at the population level to awareness of these conversations of mortality when it can be frightening and difficult? And I think probably my guess is that most of us only start to confront this either when we get a diagnosis, when a loved one gets a diagnosis, or when somebody that we love passes, unless people are like, I think, extremely aware and sort of in tune. And so I know this is a big question. And in preparation, we had some back and forth, and you suggested reviewing Plato's allegory of the cave from the Republic. And I can see how this allegory helps us think about this. And I'm going to ask for your thoughts, but just briefly for listeners so that they can be reminded. So the cave there's a cave, and prisoners are chained inside of this dark cave facing a blank wall. And they've been there since birth, and they can only see shadows cast on the wall from objects behind them. So they can't see the objects themselves, illuminated by fire. And this is like their perception of reality. And then the prisoners take these shadows to be what's real, because it is real for them. It's all they know. And then one of the prisoners is freed and exposed to the outside world. And after he adjusts to actually being able to see in sunlight, he sees like the true nature of things. And then he comes back and he tries to inform the other people like, no, this is really the way it is. And the other people are resistant and hostile because it's changing their version of reality, which is quite difficult. So anyway, can you share your thoughts on both the allegory of the cave and like how it relates to the work that you're doing, and also just this broad question of like, do you have thoughts on how at a population level, like at a broader level, we can expose people to thinking about this at an earlier age so that they're more ready and have more peace when it comes to the end?
First of all, thank you for going with me on a journey to the allegory of the cave. It warms my undergraduate philosophy student's heart, and to offer that to more people. Yeah, the thing about the allegory, I think in this context, that's really, I think, important to keep in mind is that piece about, it's so inspiring to get a view to something that feels so true and so empowering, like reflecting on our mortality and the fragility of our lives, but also recognizing that, as you've mentioned a couple of times in our discussion already, most people come to that when they're thrust into it. They don't go there willingly, even though on the other side of that exposure, there might be something really brilliant. I think as we're able to go through that hard process and we see the brilliance of it, we're often inspired to say like, hey, I want everybody to kind of know about this. But it's that piece of the allegory, where they try to go back in and share this gift of seeing reality more clearly with others, that you encountered that there can be a lot of resistance, because exactly, you said it so well, confronting the fact that what I've thought is real may not be the whole story can be really upending and
Yeah.
upsetting. And I think about that when I myself think about this really important question that you're raising, which is, how do we try to bring this conversation and the gifts of this knowledge and these observations to the broader public? Because in my work, I'm privileged that I'm just dealing with people who have been thrust into it. And that has its unique challenges, but also opportunities, right? They are motivated to be in that discussion one way or the other because life has put them in it. When we think
Yeah.
about how do we get everybody else into that conversation, I think we have to think about that differently. We have to recognize that everybody's living inside of their life, whether they've managed to find some kind of stability in the way that they're thinking about and approaching it. And if we try to barge in the door with uninvited knowledge, that can be very confronting, that we may not be received very warmly. And so I think that the challenge in the question is that everybody is kind of where they are. And we absolutely live in a society and a culture that doesn't have a robust conversation going on about this kind of question. And so, I think, again, coming back, your question is, so what can we as individuals do to move the needle there? And I think, this conversation, your work with the podcast and the conversations you're hosting is a really good example about that, is for folks who have gone on this journey and are carrying that, can we, one, recognize that everybody's on their own journey, their openness and their readiness for these conversations will vary. Can we be sensitive to that and try to meet them where they are? So can we be gentle in offering the invitation? And can we talk about, the parts of this knowledge that are inspiring and opening, right? Can we talk about the benefits of this conversation rather than just jumping into the nitty gritty or the parts
Right.
that can be more confronting? When I think about examples like there's the death cafe movement or
Yeah.
the death positive movement, I think those are really the examples that are being set there. It's like, hey, here's something that's really welcoming, to sit down and have a cup of coffee and talk about what's important to us and inside of this specific domain. And as our lives go on, we all do come into contact with fragility, with death, with loss, with grief in many different ways. We don't have to start by talking about the consideration of our own mortality. We can talk about other kinds of death and loss that we've experienced and what we've learned, because the lessons really often have a universality to them, right? The lessons about grief as we go through life transitions offer us a lot of potential insight and understanding about the grief that we experience facing our own mortality or the loss of people that are very close to us. So, the simplest version of my answer, I think, is to do this, to offer the conversations, to offer them in a welcoming way that meets whoever it is we're in conversation with where they are, that's curious and exploring, that we can find a way to attune together, we can get on the same wavelength, and then share, our knowledge and wisdom together in a way that's hopefully welcome, right? That
Yeah.
isn't traumatizing, that isn't
Yeah.
overstepping a boundary that someone has set, because that's where they are with their reality right now, right? I might need to focus on the puppet because I'm not ready to see the tiger outside the
Right.
cave,
Yeah.
right? And then what can we do to help each other build readiness, right? Because that's, I think, the thing. We're all in this together, trying to make sense out of this thing and trying to move through it as skillfully as we can. For people who have received knowledge of any kind, again, I think in your experience with your father and with your family, you've garnered a lot of really valuable lessons, and I think you're eager to share that with others. I think the question, the allegory the cave raises for us is, what can we do to try to set ourselves up for a warmer reception where we
Yeah.
can actually be of use and of help and offer the knowledge and share that's driving you toward those conversations.
Yeah. So that I agree with all of that. And I think that's really good advice. One of the things that I was thinking was, is it possible to introduce this topic at a much earlier age, like in high school? Like, I am a strong believer that we should have like basic financial literacy training in high school, which is not offered. And I think this is another kind of education that could start earlier, so it's not as frightening, or it's sort of like this thing that might happen in the future, but at least we're hearing about it. And sometimes you have to hear things like 10 times before they sink in, kind of thing. So I don't know. I know that that's probably a long shot, but I think it would be amazing to have some kind of course where there's just an introduction to these concepts. And even to, one of the other conversations I had as part of this series was with this amazing company called Recompose, based in Washington State, which is human composting. And even just thinking about, like, when you die, whenever that happens to be, have you thought about what you want to happen to your body? Like, do you want to be buried? Do you want to be cremated? Do you want to be embalmed? Do you know what that does to the earth? Because people often don't. I mean, I did the research for the conversation, but even I didn't know the historical relevance. I didn't know the environmental impact. I mean, these are not things that we really like talk about and know about. So I feel like there is like a huge opportunity at a younger age, when it's less in your face, to at least open people's minds, and then maybe they can come back to it, when they have a bit more maturity, and dig in more easily, potentially. I don't know.
Yeah, I mean, I think you're touching on something really powerful, right? The earlier we get into a conversation, the more time we have to explore the fine details of it. And I think the other thing that I really hear you touching on that I think is so important to name is that, there's the intellectual content of these questions, and there's the emotional
Yeah.
resonance of the
Yeah.
conversation. And I think that's the tricky thing we're always moving through, definitely in our work in palliative care specifically. And I think we could fairly say in life in general, there's like what we want to do or need to do and how we feel about it. And often, our emotions can come at us sideways if we haven't spent time developing our skillfulness and making room for them and noticing them and being able to name them. They can hook us
Yeah.
and move us in directions that we wouldn't necessarily choose to go.
Yeah.
And it can take time to recognize that that's what's happening, that, hey, the way I'm thinking about this or the way that I am in this conversation is really being colored by unresolved emotions that I'm having or prior experiences and the way that they're living in me. And so, I think part of the desire to start the conversation early is to have time to work through that. I think we definitely observe that in our work. When people have not thought about these questions and are suddenly thrust in a situation that is potentially life threatening, where there's so much going on, it is so much harder for them
Yeah.
to make progress and for them to
Yeah.
address these things. It's where often a team like ours can be of benefit, where we can try to create a structure of support around people to help them move through it, because they haven't had the opportunity yet to build their own skillfulness there. So we're both trying to support them and support their building that skill for themselves. And how far we're able to get with that can really vary based on
Yeah.
where someone was when they started and how fast their story is moving. And I think, share your desire that everybody have the opportunity to get to those important moments with the support they need. And so, yes, like, let's figure out ways to get that conversation moved earlier and get people involved in thinking about it. And I think aspirationally, like, the more people we have in that conversation, the more human ingenuity and creativity I think can enter that space. Again, look at
Yeah.
things like death cafes, right? If you attract people to the conversation, so much unexpected stuff shows up, that can be really exciting and really inspiring and really move people in ways that, I may not have expected, because I only have,
Yeah.
my limited human experience and perspective. And so, when we come together and we're in conversation, so much beautiful, unexpected creativity can be unleashed. And so I'm all for it, Ashley. I want our educators to be taking on that question. I want to see a curriculum for high school students looking at that. I think we see pockets of that in different places, and I think that's inspiring. And again, I think this conversation is another entry in that effort. And so
Yeah.
just so delighted at the way that you're approaching it and these opportunities you're creating for people to come in contact with these questions and be thinking about it, and hopefully having their own conversations, bringing things on the table in their own homes.
Yeah. Yeah, definitely. And it's funny because I was thinking as I was preparing for our conversation that my journey sort of thinking about death and dying and preparing for death has been a lot like parenting teenagers. And I have two teenage boys. And I think I shared with you, I really wish now I had started reading about teenagers and the teenage brain and everything that they go through, like research before they were teenagers. That would have been like extremely helpful to me. And I did not do that. And maybe that's in parallel. Like here, I feel like I am doing the work before. And I think that it's so benefiting. And one of the things I would say that's been most helpful in like parenting advice that I've had is to acknowledge and accept that my kids' journey is their journey and not my journey. And that I can do all the things I can do to teach them and encourage them, but I can't make decisions for them. And ultimately, like what I need to do is I need to let go. And I think this feeling that the in letting go is the peace is the same for parenting teenagers and for thinking about death. And it's not, I'm not saying it's like you get to this nirvana and then you're there. For me, it's not that way. It's work. It's like there are days both for parenting and for thinking about death where I have more peace than other days, where like I can accept and let go more than other days. But I at least can acknowledge that when I am in this letting go place, I do feel more peace. And I do think that to me, that was really a lot of that paper on existential maturity in the letting go, and like what is comes much more peace. And I just thought that might be like a useful analogy for people to hear because a lot of people know about parenting teenagers. and it's just, think about sort of an analogy in any part of your life. And when you prepared for it, how much, and when you can start to like let go of things, how much better things are. And that to me is why I think this is so important, because I really feel like there's so much pain and fear at the end of life, and there is an opportunity to lessen it. And that to me is like why this matters so much.
Absolutely. I think beautifully said. And I think a really a proper analogy, and I think such a wise insight to take from your experience of parenting to our experience of living. I think another way we can also kind of tilt that and frame that, this notion of letting go, one would be maybe to focus in on what is it that we're saying we're letting go of. I think what I hear you saying is we're letting go of our expectation for a specific outcome. And another way of saying that might be that we're opening ourselves up to accept what comes, right?
Yeah.
That can I let all of that in? And I think what that begins to show us, or what that opens for us is that if we can focus on accepting the world the way it is, our children the way they are, my life the way that it is, if I can let that in, that doesn't mean that I'm not going to feel anxious or I'm not going to feel sad, because there will be times when my kids don't get it right or don't hit the mark the way I'm hoping or expecting them to, and I'll feel disappointed. But accepting it, letting go and accepting it means letting in that disappointment.
Yeah.
Right. And staying connected to what's important to me. In your motherhood, I imagine continuing to show them love and support, right? That you can still be that steadfast parent, that presence in their life that you want and hope to be, that you can be connected to your values. And I think that's such an important part of that openness and that acceptance is it allows us, or hopefully frees us from getting hung up on those challenging emotions or those
Yeah.
big feelings in a way that might otherwise get in the way of continuing to show up in the way that we want to be there. And I think
Yeah.
very similarly, the aspiration I hear you describing, I think is such a beautiful one, is what would letting go, what would accepting what is do for allowing me to move through even the end of my life in a place of peace, in a place of equanimity, but recognizing that also means letting in anxiety that might be there, letting in grief that might be there, anticipatory grief, sadness, as well as joy and happiness and love and connectedness, right? But the key
Yeah.
is, can I let go of expectation? Can I accept what comes, even in challenging emotions, even in circumstances we may not choose? But can I maintain a posture of curiosity and openness and not be
Yeah.
too tied to a specific outcome, even while I may be hoping for specific outcomes and doing what I can to try to achieve them?
Yeah. Yeah, absolutely. So, a quote from the existential maturity paper that stood out to me is this: Ernst Becker argued that death anxiety is so fundamental and driving that everything in life can be seen as an effort to soften the reality of death. And you mentioned this concept or idea of terror management theory, which came out of Becker's work. Can you share with us what that is?
Yeah, and I'll start by saying I'm certainly not an expert in terror management theory,
Okay.
but I think it really, that quote gets at the heart of it, right? There's this notion that everything we're doing as human beings is at some level an effort to try to cope with or mitigate the anxiety of death, right? That sort of notion of an ultimate terminus in our lives, the conclusion of what we are. It's really difficult to argue against that notion, because it is like the most basic fact of our existence, is that, there is an endpoint to it. And trying to make sense out of that, trying to understand that, trying to figure out what that means for the way that we should live our lives, absolutely colors everything that we do. The theory, I think, is very interesting because, it allows us a way of looking at, again, how we navigate our lives and how we make our choices, how we are challenged inside of those spaces. It's been called the mother of all anxieties, right? Death anxiety. It's a really interesting question that's garnering more attention in my field, certainly, both in terms of trying to understand what this means and trying to understand how to support people that are experiencing that in the myriad
Yeah.
ways that it can show up, right? The kind of existential questions that it raises for us, right? Like, well, if this is coming to an end, or if this has an end, well, what's the point? What does it mean? And those, of course, are questions as old as human civilization, right? I think if we look at the great religious and spiritual traditions, if we look at the great philosophical traditions, these are often kind of core questions that are there, which I think also offers a response to questions that you raised earlier in our discussion, right? Like, how does the broader population confront or come into contact with these? For a lot of people, it's their individual experience, like we've talked about, having a loved one go through a serious illness or
Mm-hmm.
die. But also, I think in those other contexts, right? Like, what communities are we part of, and what is that tradition's practices in terms of exploring and confronting these kinds of questions? And so, yeah, terror management theory is a psychological look at that question and an exploration of that piece. There's a lot of really interesting work that comes out of that. I think it's applicable potentially to all of our lives, because again, it's sort of the one fact, wherever you grew up, whatever tradition you're part of, whatever your life is like, the one thing we all for sure share in common is that we're going to die, and trying to figure out what that means
Yes.
for us, and how to engage with that question and how to live in the light of that reality, again, I think has, as you've said, potential value, right? The reason we're talking about this is because there's a ton of different values, like we've already touched on, the opportunity to go through it more gracefully and skillfully, the opportunity to grow outside of that space. I think something else that you've really touched on that we haven't necessarily named yet is, when we engage in that work, that also becomes part of our teaching for the people around us. And again, I think about, your role as mom and what you want to offer your children in terms of helping them develop and grow. Part of the reason you're doing this work is because of the gift your father gave you, right? In being part
Yeah.
of that journey for him. Right. And I think that's an opportunity that not everybody in our society has. We often, we hide people as they're getting older, as they're getting more infirm, as they're approaching death, as they're dying, as they die. A lot of people don't have that experience, and that leaves our society poorer. And so I think having had that opportunity to be confronted with that question, to see the value of that for yourself in your own life and your living, the way that you're translating that beautifully into trying to offer that to your children to help them in their preparation and their living, recognizing that that's their own journey. I think that's such a beautiful reflection of what we are, which is not, discrete individuals. We're part of this much larger community. And there's important questions for what does that mean for how we should live? What do we owe each other? And how ought we engage around these kinds of questions? You were thrust into this knowledge and have gone through a really difficult process of confronting that and living through that and attending to the very many complex emotions, the concrete decisions, all these elements we've been touching on. And on the other side of that, or perhaps not on the other side, but where you are on that journey, you feel inspired and energized to share that with others. And that's a beautiful thing, right? That fire catches and spreads. And so, yeah, I think all these questions we're exploring are so rich and so important for each of us to attend to, right? What does this mean for me? How do I want to engage in this conversation? What can I offer the people that are around me? And I'm just so excited that we have this opportunity to explore these questions together.
Thank you. So, in preparation for this episode, you suggested that I read A Beginner's Guide to the End by Dr. BJ Miller and Shoshana Berger. And I really highly recommend this book to everybody. So, it's a very practical and digestible book. And to me, much more sort of pragmatic than like Being Mortal by Dr. Atul Gawande, which is a wonderful book and I also recommend. But A Beginner's Guide to the End, it gives you like a checklist of tasks to complete, like a will or a trust, but also focuses on the emotional side of things by suggesting an ethical will. And I have actually an entire episode with Susan Turnbull, who's mentioned in the book, about ethical wills and just being prepared, like being prepared on the paper side of things to make things easier for your loved ones. And also going through like just the realities of what happens when you die and the choices that you can make with your body, which is what led me to find Recompose, because they go in detail to like, this is what happens when you're embalmed, right? And people don't really talk about that. So I thought it was extremely helpful. And I do think that you have to be ready for it too, because it could be a bit jarring. Like they're pretty like, this is these are the facts kind of, and these are your choices. And so I don't know if you feel like, is this a book that you recommend to a lot of people? Is it something that you think people should only turn towards like when they've done some preliminary work on the subject? Or what has your experience been in the reaction that you've gotten to the book?
Yeah, I don't recommend the book to everyone. Like it's not something that I recommend to every patient that I
Yeah.
see. Not because it's not a potentially valuable tool, but I think for the reasons we've talked about earlier, not everybody is ready,
Yeah.
to engage with that book. I think for people who are at a point of readiness and curiosity and are looking for a resource, it's a go-to to recommend, which is why I recommended it for this conversation, because you're in a place where you're really interested and curious and looking for resources. So I have recommended the book, but I'm thoughtful about who I recommend it to and when and why, because it is such a beautiful tool, right? It was thoughtfully created with the end user in mind, that this is a tool for people who are on this journey, either for themselves or are accompanying someone else who's dealing with a serious illness. They created it to be a palliative instrument, right? They made choices in the way that the typeface was set and the spacing on the page, so that it would be easy to read and like give you a sense of comfort. Like
Yes.
it's such a wonderful, beautiful, practical support and tool, and does cover all of these domains. And all of that said, it's not going to be for everybody, right?
Yeah.
I've certainly offered it to family members who are on a journey of accompaniment and who said, boy, thank you for sending that to me. It was so helpful. And, my wife is absolutely not going to read this, right? She's not in a place to do it. And again, I
Yeah.
think it speaks to that piece of like meeting each other where we are, right? There's
Yeah.
different tools and pieces that I recommend in my practice based on my understanding of where people are, what they seem to be ready for. And part of my work is anticipating what's ahead, having gone on this journey with many people and knowing what the common pitfalls are and the struggles, and try to help them get ready so that if we're not there, that can we try to sort of get there. And also recognize not all of my patients are great readers, right? Some folks need different resources. They need to hear the message in different ways. And so that's another reason. But I think for folks who are engaged in the question and who are into reading books, I'm not aware of a better resource. Because again, I think Dr. Gawande's book is a fabulous book, but in many ways was not necessarily geared toward the end user, right? It's raising some similar questions, but it's raising them in more abstract ways where a beginner's guide to the end is really there to kind of be on, sort of hold your hand and take that journey
Yeah.
alongside of you, and is structured
Yeah.
in that way. So yeah, there's tons of great resources that are out there online, podcasts like this one, I think, exploring these questions. And to me, I think that's the key. If we understand that everybody's in a different place, it's how can we continue to develop tools that can meet people in the places that they are?
Yeah.
And perhaps the best part of that is to, be a human being and encounter the other people that we encounter, and be able to hold these questions lightly and meet folks where they are and really accompany them. The reach of that is certainly limited, but I think, culturally, the degree to which more of us are engaging in that is to the benefit of all of us. But
Absolutely.
I think you're raising such great questions, which is, how do we think about structuring things that can reach more people? And a beginner's guide to the end, I think, is a great example of that, though
Yeah.
it's a particular portal of entry.
Yeah, absolutely. But it also led me down a path. Like, I listened to a podcast that BJ Miller did, and it gave me like a little bit of insight into palliative care too, which was really, I thought, helpful for me. So it could also like spark people's interest to go down a different path as well. So going back once again to the existential maturity paper, I think one of the benefits, and as Alan put it in the paper, is that you can learn how to live buoyantly. And I loved that expression. So I feel like it's so easy to become caught up in the challenges and the chaos of everyday life. And we can miss the forest for the trees. And, 20 years can have gone by, and we look back and we wish we had done this and we wish we had done that. And I wanted to see if you agree with this, and I don't know if there's any research to support this, but to me, a persuasive reason to start on this journey sooner is that you can then live buoyantly. You can like live your life. It's really about living your life, not about your death so much, if that makes sense.
Yeah, I think it's such an important distinction. And I think the challenge is, as we've kind of touched on in many different ways, right? Like, everybody is where they are. And you can
Yeah.
imagine there are folks where, being confronted with this question can just cause them to spiral and become so anxious that they're debilitated, right? Because they're just fearful. They don't have a way to stabilize themselves in the face of, again, such a confronting question, right? And so I think that's also part of that existential maturity, is recognizing like this isn't just a simple, kind of one element. There's a multitude of elements that are there. And part of it is, our ability to self-stabilize, our ability to register and be present with our emotions, and be able to communicate and connect with others kind of around these kinds of questions. And so, yeah, I think there's no question. There's certainly many, many, many examples of people saying like, oh, just as you said, miss the forest for the trees. And I think the question that it raises, or perhaps the insight that it raises for us, is like the importance of being present to our lives, right? For many people, I think that constitutes in a mindfulness practice, right? Or a gratitude practice, something that grounds me in every day of my life, right? Whether I'm now counting them down because I've been able to scientifically get a discrete number or some sense of how many days I may have left, or if I'm just living under the knowledge that like, hey, none of this is guaranteed, and things can happen even unexpectedly. And so an insight or a lesson we may take from that is not to take things for granted, and to try to be
Yeah.
present and aware in our lives. And that presentness then may be a gateway to being more thoughtful about the way that we're living our lives and spending our time, and thinking about what's actually important to us, and perhaps taking stock of, is the way I'm living reflective of my values, right? And
Yeah.
if it's not, how could I start trying to get those things in alignment, right? But also recognizing that entertaining those questions can sometimes be a privilege, right? There's plenty of folks that are living lives where they're just so inundated with struggle and chaos that even having the calm space to entertain those questions is not available to them, or having somebody to support them in that exploration may not be right there. And so again, I think thinking about the people that are around us, right? How can we help them? Maybe it's helping them take them things off their plate. Maybe it's helping them try to find some stability, but meeting them where they are and knowing that, hey, that can open an opportunity to be part of this conversation, to think about these things. And as you said, that very profound insight from motherhood, right? That like, and they might not go through the door. I
Yeah.
might
Yeah.
perfectly prepare the doorway for them, and they may choose not to go through it, or they may choose not to go through it at this time. And so what does that mean for me? What's required of me to be able to stay open and stay buoyant and stay offering the opportunity? It's going to require letting go of the outcome. It's going to
Yeah.
require accepting what is. And so we see all of these things interrelating together and kind of holding together in that way.
I have not done any research on this, and I'm not sure if you have, but I know that death rituals are different, very dramatically by culture, by country. And, you've got Day of the Dead. You've got some cultures that like really celebrate the death of loved ones. I feel like we do not in the United States. So like I was thinking about, okay, we celebrate everybody's birthday, but like the day that my father died, September 13th, we don't call it his death day. It's the day he died. And I wonder why, if there's any like history to that, but I also feel like if we were more direct, like September 13th is his death day and we're going to celebrate it, we're going to celebrate his life, would that get us closer to sort of this acceptance of death, the reality of death, and the living buoyantly while we're alive? I don't know, but do you know if other cultures are better at this, and if they are then closer to sort of all of these subjects that we're talking about, like that they have a better ability to process them?
I certainly can't pretend to have made a deep sociological or anthropological study of other cultures' death rituals, but certainly my work puts me in contact with people from many different cultures, and I observe, the way that colors their experience. I think at that level of person to person, the other thing I observe is, cultures themselves are not monoliths, and the
Right.
ways that individuals participate in culture, like, do they identify with their culture? How well do they understand the tenets or practices that are there? It really gets to the depth of each person kind of being on their own journey. I think what I
Yeah.
observe is that people who come from cultures and participate in cultures that do put these questions forward, right? That have, regular practices that observe the fragility of life and observe the reality of death. Or, my first job, I was living and working in rural Missouri. So a lot of the people that I was caring for were farmers and were absolutely, from a very young age exposed to the cycle of life and
Yeah.
the reality of death and dying. And it absolutely colored and shaped their experience as they themselves faced illness and faced death. And on average, I would say, offered a lot to their understanding and their sense of equanimity and poise. I will also say that's not universally true. People still struggled, right? We're still individuals, and our
Yeah.
journey and our life's experiences also has a say in how we are and how we feel and what we do beyond just culture. But again, I think absolutely what we observe is in cultures where these questions are present and are there and are being explored, it absolutely on average has an impact on the people that are coming up and participating and are members of those cultural spaces and contexts. And the degree to which people are able to participate in that absolutely colors kind of where they are on their journey and how they kind of proceed through that space. And I think there is absolutely a lot for those of us from different cultural contexts to learn and to explore and to inform ourselves, in our own journeys inside of those spaces. And so I think it's a beautiful insight, and I think a great opportunity for us to think about, what practices might we borrow, right?
Yeah.
And might we participate or find ways to participate in, like marking death days, taking time. I love that the notion that you're offering, because there's an element of mindfulness in it, right? That we're going to intentionally set aside a time to remember this person, to embody them in
Yeah.
ourselves, right? Or whatever that might look like. And in that way, feel that closeness, feel that connection, keep their spirit alive, as we all do, right? As being living embodiments of the way that they color who we are and other rituals. It's beautiful.
And what's interesting to me in doing the research on sort of the death rituals in the United States is that they can change relatively quickly. So I do think it's like not irrational to think that we could do research on death rituals in other cultures, find some that are particularly like peace inspiring, and try to get something adopted. Like, it's not out of the question that we could do that.
Yeah. Yeah. It's a matter of being curious and going out to learn. Yeah. I think
Yeah.
it's a beautiful idea. And I would imagine that there are people that are engaging in that. I, again, have to come to the question from a place of humility that that's not my area of expertise or work.
Yeah.
Certainly my work puts me in contact with that question. And I think that it's a really interesting one.
Me too. I'm going to look into it some more. So I found this quote on your ex former Twitter page that it just resonated with me. So this is the quote: "The great enemy of communication is the illusion of it. We have talked enough, but we have not listened. And by not listening, we have failed to concede the immense complexity of our society, and thus the great gaps between ourselves and those with whom we seek understanding." So you told me that this quote is from the sociologist William H. White, even though it's often attributed to George Bernard Shaw. And I feel like this is such a perfect quote, sort of expressing why human connection eludes us today. And it probably has been an issue for the ages. And one I'm trying to put a dent in with this podcast generally, but I also feel like it does speak really nicely to this particular topic. So I'm interested in why you chose to put this on your page and how your work you feel is dedicated to changing this, even if it's in some small way, you know?
Yeah, absolutely. It really resonated with me, as it sounds like it did with you. Both, I think, directly on X or Twitter, right, where we're like have these truncated communications, and so I think the risk of misunderstanding each other or not listening deeply enough is certainly heightened, and definitely profoundly in my work. You know, so much of what we're doing in palliative care, especially when we're helping people navigate their decision making for themselves or on behalf of their loved ones as surrogates, really comes down to that communication. And I think that's something that I observe time and time and time again, is that, you know, we think communication is happening and we're really wrong about what's going on. And living in that understanding, keeping that in the forefront is, in my mind, an effort to try to avoid falling into those traps, is really slowing down a lot and asking really deeply, like, what is it that we're saying here? What is it that you understand? Have we effectively communicated what's going on and the meaning of that, you know, in a broader way? That often, you know, decision making in the context in which I'm working is both a matter of understanding the facts and processing the emotion and recognizing that there's an interplay there, that it's really important for us to be looking at both of those factors. And so that's, I think, how that idea informs my daily practice and my life as well, is trying to really be humble, you know, that, hey, I may not be communicating this as clearly as I think I am. And it really is important to slow down and to ask a lot of questions and to try to really understand where people are coming from and listen to them deeply, particularly when we recognize what we've touched on a lot of times in our conversation, the importance of meeting them where they are. You know, so
Mm-hmm.
can I listen first before I speak? So that
Mm-hmm.
when I speak, I'm meeting you in the place that you are. I'm using words that are going to mean something to you because they align with what you're thinking about, what you're worried about, what's important to you.
And do you think that you are successful in bringing that into your personal life too? And maybe a slightly broader question, although a big one, is do you feel like you have existential maturity?
I think I'm working on it. I certainly hope that the lessons that I learn in my work, because it is such privileged work to get to go to be on this journey with so many people in such an intimate and profound way. I really hope to reflect my respect for my patients and their families, and to honor them by living by the truths that they share with me, you know, on their journeys. I hope for that. And I'm also a person. I definitely make mistakes and I forget my lessons and I have to learn them again and again and again and again. But yeah, I think I certainly try to hang on to that. And what I recognize is that in my own life, I'm as vulnerable as anyone else to my emotions overriding my desires and my commitments. And so it's important that that's part of my practice, that I self-reflect on a regular basis, if not throughout the day, once a day, or on some regular cadence of, how good of a job am I doing here of living according to my values, of embodying that, of listening deeply, right? Of being attentive to my emotions, of working on expanding my ability to let go and to accept what is, right? That's their practices. They're not things that we ever perfect, because as our view broadens, as we can see more of that reality, newer, more confronting questions emerge, and we have to work our way through making more space for the challenging thoughts and the challenging emotions, and assessing, what does this mean for how I'm going to live my life? And how do I continue to stay attuned to my values, or even reevaluate what's important to me to keep working through that? So those are things I think I strive to keep in mind and work towards on any given day. I imagine I'm more or less close to them, but certainly my hope and my desire, my intention.
Amazing. So at the end of every episode, I have 5 questions I ask everybody. But before I do that, is there anything that I haven't asked you that you would like to share about your work, about, approaching death and dying, anything at all?
I think, I think I missed an opportunity to touch on something that you offered me earlier in a question. And that is, I think the focus of my work in palliative care encompasses dying, but it's principally more about living. In an earlier question, you said, it's not so much about death, it's about the living. And I think that's something that's really important about our work. I might just briefly offer a definition of palliative care for those who are
Please.
listening who maybe aren't familiar. Palliative care is specialty care for people living with serious illnesses. It's available at any age, at any stage, and no matter what someone's goals are. Our focus is to improve quality of life for people dealing with serious illnesses. And principally, we tackle that through helping address the symptoms of illness and the side effects of treatment that might be challenging someone's quality of life, to help them be as comfortable and symptom-free as possible. I think about that as optimizing their energy, right? If I can help alleviate your pain, then that's energy you get back to spend time with your kids or your grandkids, or watching baseball, or eating ice cream, or whatever it is that's meaningful and valuable and important to you. And the other part of our work is focused on communication and coordinating care, making sure that our patients and their loved ones understand as best they can what's going on, have a chance to think about what that information means for their goals, what they're hoping for to get out of their treatment, recognizing that those goals are unique to each person and changing over time, and trying to make sure that the plan of care that's put in place reflects those unique individual and changing goals. And so the focus of palliative care is to be an extra layer of support for people dealing with serious illness, taking that broad view, like we talked about earlier, not just the medical aspects, but the emotional, the existential, the spiritual, and the practical, by working inside of an interdisciplinary team with the expertise of physicians, social workers, nurses, spiritual care providers, to really look at the big picture for each person and accompany them on that journey. It is unfortunately often the best kept secret in the healthcare system. And so I think it's really wonderful to have an opportunity to let people know we exist. We're here to support you no matter where you are in your journey, no matter what your goals are. And our focus is to help you have the best quality of life you can, and to live every day as fully and as well as we possibly can.
Here are my 5 questions. The first one is, as we explore in my brand, Amatand, which is French for to take care of your soul, objects can hold a lot of meaning for us, and they can tie us to the past, enable us to enjoy the present more, or even take us into the future. Can you share an object from your life, whether you still have it or not, that holds meaning for you, and tell us why?
When I was going through my training and was living the life of, a relatively poor student, I had for a while this thought that, when I finally get a little further along and I'm making some money, I'm going to get myself some nice kitchen knives. And a dear, dear friend of mine gifted me, knowing that was my vision, gifted me a couple really nice kitchen knives. And so whenever I am using them, which is typically to prepare nourishing food for myself and for loved ones, I think about them. I think about that gift. I think about that time of life. I still have those knives. They are in desperate need of sharpening, but it was such a beautiful, thoughtful gift, a practical item, which I think your brand as well is filled with rich and thoughtful items to improve the quality of people's lives and the connection between them. So I really appreciate the work that you're doing and what you're bringing into the world. And yeah, so whenever I use those knives, I think about that time in my life, and I think about that friendship and those people, and just that act of kindness to try to get me a step closer to something I was dreaming about.
I love that. That's amazing. Well, that kind of ties into another question. So I'm going to go out of order, which is, are you in a phase in your life where you enjoy entertaining in your home? Why or why not? So it sounds like you like to cook for other people.
I do like to cook, and I do like to entertain. In this chapter of my life, so I relocated out to the West Coast, and the cost of living here is very different than it was back in the Midwest. And so my life circumstances are such that, the space that I have to offer people is an order of magnitude smaller than the one that I was most recently in. And it's something that I've thought about in that transition. What does that mean for my opportunities to entertain? And the truth is that I can still entertain. It's in a smaller space, so it'll be with smaller groups of people at a time. But there's a loveliness in that where perhaps I won't be able to connect, people from different areas of my life as I could when I host a large group, but to be just in a space with someone where I can offer them hospitality, comfortable space to be a place to be comfortable and to be safe to explore interesting questions or share deep feelings or explore the kinds of things you and I have been talking about is I think one of the great joys in life.
Yeah. I mean, I like just to talk about, and every guest has sort of a different story and a different way that they entertain if they like to do it. And it's really just about like the getting together. So it's like some people like to cook, some people don't like to cook. It's all good. It's like just spending the time is what matters.
Totally.
Can you share a favorite tradition with us? It could be something from when you were a child or a recipe or someplace you go, anything at all.
My family are great celebrators of birthdays, and a tradition from my father's side of the family, they're great lovers of ice cream. And in particular, the tradition is on your birthday that you get a banana split. My grandfather, Jack Gamble, who died a few years ago, was a great proponent of that tradition. And I have a wonderful photo from, I think it was his 93rd birthday, of him absolutely smashing a beautiful big banana split. And so usually on his birthday, which is coming up, it's August 30th, I will try to go have a banana split. It's a little bit outside of my normal dietary spaces, but it's a lovely tradition, and it's a way that I like to remember him and think about him and all the fabulous, crazy ice cream stories that he used to share with me from his youth and childhood. And loving ice cream myself, it's nice to know that I came by that passion honestly, and it's a through line in my family that I think is really lovely, and I like to be connected to.
I love that. I would love to see that picture. So my dad loved donuts, and we have this like hilarious family story where we went to this really nice restaurant and had this like amazing large meal, and then afterwards we stopped at the donut shop and got donuts and took them home.
Oh, I love it. I love it.
So yeah, I can relate. So in my family, it's donuts,
I love
and
it.
not on a birthday, but like it is actually a nice thought. Maybe I can bring the donuts into my dad's death day. I'm going to think about that.
I think it's a
Yeah.
great opportunity. There's never a wrong time for a donut.
Also not part of my regular diet, but once a year you could do it. So we've talked a little bit about some resources, but do you have one or two top resources? Could be books or podcasts or courses that you can recommend to listeners. I know we're just on another podcast. Maybe you can share that one with us. So anything, because I do agree people learn in different ways. And it doesn't have to be, obviously you're a reader, so it doesn't have to be about this subject. It could be about, it could be just like a couple of your favorites.
Yeah, I know, you've raised questions about like transitions and good resources for people like looking at transitions. Probably, I think the book that I've maybe recommended the most in general in the last few years has been a book called Never Split the Difference by Chris Voss. It's a book on negotiation. The things I really appreciate about that book, Mr. Voss was the FBI's lead international hostage negotiator. And in that very high stakes job, I think really did a brilliant job of kind of figuring out the underpinnings of interpersonal human psychology and uses that to inform the work of negotiating, which is basically getting with another person and figuring out how do we both get what we need out of a situation by doing a
Mm,
lot of the things we've talked about, listening to each other deeply, understanding and showing that we understand where someone's coming from, figuring out how we can help meet their needs so that they can be engaged in helping to meet our needs. I think it has
mm,
wide application in our lives, in our interpersonal lives, in our work lives. When we're looking for work or thinking about changing jobs, a beautiful piece of advice I think from that book is shifting our way of thinking. When you're at a job interview, the main objective is not to try to get the job, it's to figure out whether you want the job, whether it's the right job for you, which I think is so wise. And really looking at so much of negotiating as getting information. Again, I think getting back to that wonderful quote, hearing and listening and thinking deeply. So a book I think is great for anybody and a really useful tool. I think that one's fabulous. We've talked about different resources. I was recently on the Jerry Powell podcast, which is hosted by Alex Smith and Eric Wadera, two really fabulous geriatrics and palliative care docs who host fantastic conversations in both the geriatrics and palliative care space. So I think for anybody who's interested in deepening their knowledge, learning more about how doctors think and talk about these questions. It's a fabulous show. They've been doing it a long time. So they've addressed a lot of questions. So anybody dealing with serious illness, I think, can find something valuable in there. And it's a podcast. It's very entertaining
yeah.
and easy to listen to. So that's a great one. And I might just also mention a couple websites for people who, as you mentioned, are going through that checklist of preparation for the future. Prepare for Your Care and 5 Wishes are both really wonderful websites that are kind of person facing, patient facing, and they're structured to be good supports in having some of the kinds of conversations we're talking about what's important, and actually turning that into meaningful communication instruments to help inform their
Yeah.
care. So advanced directives, power of attorney for healthcare, really important documents that everybody over the age of 18 should have. A lot of people struggle to think through how should I talk about it. And those are fabulous free resources for people to access that can really help them have that conversation with their loved ones and turn that into documents that can help with their care. So great resources I think everybody can access.
That's great. And I'll put all of those in the show notes. Last question. What do you do for yourself? Do you have a practice, a focus, a habit, or daily routine that contributes to your success or well-being? And I'll just note, I had a conversation with a therapist who said both therapists and healthcare workers, in her opinion, need therapy because you hold the burden of your patients. And so it's like a whole nother level. So I think, you've talked about how beautiful your work is and how meaningful it is. And I imagine it also has to be heavy and maybe more so at certain times than other times, but it just has to be. So I think and you have a very like light disposition. So there must either it's innate or genetic, or you have some practices that also help you. So I'm particularly interested to hear in your case.
Yeah, I don't think it's innate. Innate
Okay.
in myself and in my family line certainly are depressive and anxious tendencies. And so I think that puts me in contact with the need to figure out how do I stay steady, because that is a tendency that my brain has. And so I think, the big ones that I think everybody can benefit from, like making sure we have some kind of regular practice that attends to our physical, emotional, and spiritual, existential well-being, right? How am I engaging with those questions? When I really struggle and then step back and reflect, it's usually because I've come out of balance with some of those things. I'm not sleeping enough. I'm not exercising regularly. I'm not connecting with people that are deep in my heart. I'm not engaged or connected to my sense of purpose and meaning. In a broader sense, yeah, our work can be really heavy. I feel really fortunate to be part of a team here at Stanford's palliative care program where that's really front of mind. And so we do, as a group, have practices to remember our patients that have died, to process the kind of emotional weight of our work and to be doing that on an ongoing basis. I have spent a lot of years in therapy. I'm not currently in it. And that is a place that I think is lacking. It's something that I would like to get back to. But I also recognize that not everybody has access to therapy and not everybody necessarily needs or benefits from formal therapy. Often it's just a question
Mm-hmm.
of, do I have a regular space where I'm processing my experience and making room for my emotions? And that can look a lot of ways. That can
Mm-hmm.
be a meditative practice, that can be a prayer practice, that can be a journaling practice, that can be, connecting regularly with people that are important to you. Probably one of the practices I've kept the most dutifully over the years has been connecting once a month with a dear friend. We could call her a friend-tor, Dr. Allison Jordan, who shares my same training background of internal medicine, psychiatry, and palliative care. And we just connect regularly to check in on each other as people, as
Mm-hmm.
professionals. And so having a space with someone who thinks similarly to the way that I think, who has experiences similar to mine, where we can share our struggles, our challenges, internal and external, and reflect back to each other our strengths, when we're feeling low, has been such a stabilizing practice for me. And so again, I think that connection to what's important to us and that processing is crucial, but can take many forms. And I
Yeah.
think often it's exploring, where are you in your life? What's available to you? And the question becomes, am I engaging it? Not am I engaging it properly, but am I engaging with that? And just continuing to evaluate as you go.
Yeah. Thank you so much for joining me today. It has been an absolute pleasure talking with you.
Thank you for everything that you're doing to help us as a society and culture to move more closely into these conversations. Thank you for this opportunity, and please keep up the great work.
If you enjoyed the show, please rate, review, and subscribe wherever you're listening. It helps us reach more people who just might need these conversations. If you have ideas for future guests or have feedback, you can reach out to us by visiting onthetablewithashley.com, linked in the show notes. On the Table with Ashley is presented by our elevated everyday home brand, Amatand, which you can find at amatand.com. That's AMEATENDRE.com. You can follow us on Instagram and TikTok at Amatand. And you can learn more about products related to the Death and Dying series at amatand.com. Thanks for listening.